Alrighty, today we're going to be doing the wound care skills checkoff. The first thing that I want to know before we get started is I have 2 hot dog buns. One of them is right here, the other one is off screen, and I'm going to be swapping them about midway through the presentation, but it'll all make sense once we do that. Alright, so the first thing you're going to do for this is you're going to go ahead and knock on the door and see if you can come in. As soon as the patient allows you to come in, you're going to introduce yourself and talk about what you're going to be doing. So, hi, my name is Carson. I'm going to be your nurse today, and today we are going to be undressing and then redressing your wound, covering in your gauze. And I'm also going to be checking on your wound to make sure that there is no signs for infection. Once that is said and done, you're going to go ahead and close up the privacy shade, and then you're going to wash your hands. As soon as that's done, you're going to check the patient's wristband and get them to say their name and date of birth for the 2 patient identifiers. So in this case, my patient is Sam Wilson, born January 1st, 2000. Once that is done, we are going to check and see if they have any allergies, and while they're letting us know about that, we're going to check their vital signs and make sure everything looks good. So once we've got that all sorted out, the patient, I would like to note, has no allergies, and all of their vital signs are going to be listed on the ADPI. For the most part, there is no abnormalities in their vital signs: blood pressure, pulse, respiration rate, oxygen level. I also have their pain level noted right now at resting. They're at a 4 out of 10 in pain, and that's good to go. Before we go any further with that, we would obviously as well gather any subjective data that we may need. So particularly cold spot, character, we can talk about the wound a little bit, what it looks like on the outside, if there's any smell, if there's any drainage, things like that. And that's all things that we're going to be able to see. Along with that, you're going to talk about the onset, when the wound first happened, which is 3 days ago. You're going to talk about the location on the thigh. We're also going to talk about duration, and duration is basically going to talk about pain and how long the pain's been happening for, and the pain's been consistent at a level 4. You're going to talk about the severity, which means that the pain, and in this instance, the pain is going from about a 4 to an 8 throughout the entire time of having it. Now, that 8 portion is going to lead into pattern. Now, that pain increases when walking, and it also begins to radiate more throughout the entire leg. And then associated factors, again, is walking. Walking makes the pain worse. Resting makes the pain easier. Once that is said and done, you can go ahead and actually begin the wound care setup. First things first, what we're going to want to do is open up all of the boxes. So there's that one. I'm going to open up this one as well. And then we're going to set up our biohazard bag. Once that biohazard bag is all set up and good to go, and it's in a position that makes sense for you, I'm going to move it. I'm going to move all of this so that I have plenty of room. Push this back as well. Once that's all set up and good to go, we will begin putting on sterile gloves. And as soon as these gloves get on, hold on. As soon as the sterile gloves get on, we can go ahead and begin the examination. There we go. Alrighty, so now our gloves are on and good to go. We've got all of our proper PPE on. We are going to begin the process of actually taking apart the wound. Now, some things that I would like to know before we continue: if we had done this previously and the patient was in any pain, you're going to want to pre-medicate them with some sort of pain med, probably through an IV line, just to make sure that they are comfortable throughout this entire process. All right, so first thing I'm going to do is pull this off. Here we go. We're going to take a look at the wound covering. Now, I did not want to put anything on this actual wound covering to ruin it or spoil it, so I left it clean, but for the sake of this example, we're going to say that the drainage is sanguineous, which means that it's red and it's bloody, and there's not a lot of it. We're going to say that there's not a lot of it, but there is some drainage on there, so that is a good sign. We're also going to take note of the smell. There is no smell from what I can tell. From what I can see of the outside of the wound, there looks to be no undermining, and the skin around the wound, it matches the complexion of the patient. There's no paleness, there's no pinkness, there's no redness, which is all good signs across the board. From there, we're gonna go ahead and wrap this up, and we're gonna put this in our biohazard bag. Next thing we're gonna wanna do, grab our sterile forceps, and we are going to pull out the gauze. Now, like I said previously, this could bring about some pain for the patient, so if you anticipate there being pain for this patient, especially if there was in previous times, give them some pain meds, pre-medicate them before. Again, we're gonna look at this, look at the drainage on these. Again, I see sanguinous. If there is serous fluid on it, there's not a lot of it. It's hardly noticeable at all. So we're gonna stick with the sanguinous definition. Now, once we pull both of these out, we are good to go. Sanguinous, we can actually take a look at the inside of the wound. However, before we continue that, I would like to quickly swap out my hot dog buns. Let's do this real quick. Alrighty, so this hot dog bun, there's a difference. This one has jelly on it. So now that we've swapped them out, let's go ahead and take a look-see. So this one, as we can tell on the inside, again, no undermining. I don't notice any tunneling going on. The main thing I would like to note in terms of the inside of the wound is that there is granulation, and that basically means that the wound is healing properly. The blood is clotting, and it's allowing for new tissue to form and retake that space. There is, like I said, sanguinous drainage in here, but it's primarily red. I don't see any purulence. There is no smell, and I'm not noticing anything abnormal. There's not a lot of serous fluid, if there's any at all. So these are all good things to know. Now, once we do that, we're gonna go ahead and grab one of our cotton tip swabs, and we are going to begin actually assessing the wound. First thing we're gonna wanna do is check the length. So let me go ahead and get this really quick. All right, so this is gonna be the length right here. I've got it all set up here, and then this from the tip of this cotton swab to my fingers is gonna be the length, and I'm gonna use this little measuring stick to check this out. All right, so it goes a little bit over 10, so what I'm going to do is mark this. I'm gonna mark this, and we are going to measure this out. So we're gonna say it's 11 centimeters in length. Now let's go ahead and check out the width. Now, obviously, for these next two portions of the exam, I'm gonna have to touch the hot dog bun. You would never do this on an actual patient to change the width of the wound, but for the sake of the hot dog bun, I have to give it some structure, otherwise it's not really gonna have a set structure. So I'm going to put this together just a little bit. Go right here. So the width, it's gonna be about this much, and we are looking at 4 centimeters in width. Okay, now we're going to do the depth. Again, same thing goes. Now, for this portion, you are primarily trying not to touch the inside of the wound. So this is the most difficult one to measure out. All right, so it looks to be about where my thumb is. That's gonna be about the depth. So let's go ahead and measure that. It's going to put us in about 2.5 centimeters. Okay, so now we have our length, width, and our depth. We would note that down for the chart, and then we are going to go ahead and move on. This is going to be discarded. And now we are going to set up the next portion of our exam. Basically, I'm going to set up sterile field now. So, first things first, we're going to grab the portion that allows you to grab, and we are going to unravel our sterile field. One thing I want to know is I'm going to have to move this chair out of the way for this portion. Go. Maintaining the 1-inch borders, we're going to lay this out. And there we go. Now, what we are going to do here is we're going to dump all of these things down. First, however, yes, we are going to dump all these things out. Here we go. So we're going to dump all this. There we go. Okay. Now I'm going to grab this one. This has been This one was a little bit more difficult, so pull this out. And we'll put the rest of this here. So, at this point, I'm going to set this off to the side. Now we can discard these gloves. Now we're going to put these in the biohazard bag, and at which point we are going to use saline fluid. We're going to fill this little box right here with saline fluid. So fill that up, and then we would fill this up as well. You'd fill this up with saline fluid. Then what we're going to do is we're going to re-put on sterile gloves, because now we're going to move on to the cleaning portion of the wound care health assessment. So I've got this right here. Before you would do this, however, in this instance, you would want to set up a diaper or a emesis basin beneath the wound so that it would drain into that. For the sake of this example, I'm going to be using this right here as my diaper. For this example anyways, obviously you wouldn't use that as a diaper in real life to catch all the fluids, but for the sake of this example, I'm going to be using this since it is here with me. Let's go ahead and set this up really quick. All right. Alrighty, so we've got our sterile gloves on. We obviously would set up this diaper right here, right beneath our. Here we go. And then we would begin the process of draining. Now I tried to keep my arms from obviously crossing sterile field so that obviously I didn't break sterile field. Now before we actually begin the drainage, I'm going to go ahead and place these two gauze in here to let them soak for a few minutes. Then we would begin the drainage. Now you're going to get saline fluid here. I'm going to move this just a little bit, and then we would drain it. Now obviously I am in this instance breaking sterile field because I'm reaching over my sterile field, but I'm running into some spacing issues. So I'm trying to do these things. All right, so we would continue draining until obviously the drainage is clear. Once this is done, we're going to drain just over here. The drainage is now clear. Once that is done, we are going to go ahead and begin the process of putting our gauze back into the wound. The most important thing here, I'm actually going to replace this really quick, is that you have to wring out the gauze before you do anything else. So I'm going to try and move this just a little bit so I can bring it back into perspective for us and get this out of the way as well. So you're going to use your other sterile forceps. You're going to pull the gauze out. You're going to pull both of the gauze out. And you're going to try and wring them out with one hand while the other hand is on the forceps. So you're going to wring them out, twist it to wring it out, and then you're going to set it back into the wound. Obviously, you would not want to stick your hand into the wound in this because that could be painful for the patient. Again, you're going to do the same thing over the container for the saline fluid. You're going to put both the gauze back in, at which point you are good to go. Now, I do not have a second wound cover, so what we're going to do is grab the old one. You're going to want to make sure the blue line is up. You're going to cover over the top of this. Now, you've completed all the things that you need to complete for your sterile technique. You can go ahead and remove these gloves. At this point, you're going to pull off some tape. You would tape the sides, and then you would go ahead and write your name, the date, and the time for that this covering was placed and the gauze were placed. At which point in time, you have now completed everything that you needed to complete for this wound care health assessment. The main thing I would like to note here is at the end, obviously, you're going to lower the bed back into normal position. You're going to raise the guardrails if you lowered them at all. And obviously, if you didn't move the bed at all, you wouldn't need to lower them. But you are going to lower the bed to a comfortable position if the patient is a fall risk, at which point in time you have completed everything. Now, you want to make sure that the patient is not in any pain. Ask if you could do anything else for them. And otherwise, if you have completed everything that you needed to complete, you can go ahead and clean up and leave.